Tonight, somewhere around 2 in the morning, more than 50 million Americans are going to throw back the covers and shuffle to the bathroom. Some of them will do it once, some will do it 3, 4, even 5 times before sunrise. And every single one of them will wake up tomorrow exhausted, blaming their age, blaming their prostate, blaming their bladder. They are all wrong. Here is what nobody tells you at your annual physical. In nearly 80% of those cases, the bladder is completely healthy. It is not the problem. The pills you have been swallowing, the herbal teas you have been brewing, the supplements stacking up on your bathroom counter, every single one of them is aimed at the wrong organ entirely. Please subscribe to Dr. Nathan Hayes and hit the like button. This channel exists for one reason. The system makes money when you stay sick, not when you get better. What I am about to tell you, nobody in a clinic waiting room is going to say out loud. So if this matters to you, subscribe, like, and let's get into it. It is 3 in the morning. Your bedroom is completely still. You finally sank into that deep, heavy sleep, the kind that actually feels like rest. And then the signal comes. Faint at first. You try to roll over. You try to think about something else. The pressure builds. You throw back the blanket, drop your feet onto the cold floor, and shuffle down the hallway like a ghost. You squint against the bathroom light. You do what you came to do. You walk back, slide under the covers, and sleep is gone. Your mind is running. Tomorrow's meeting, the bills, the kids. You stare at the ceiling for an hour. You finally drift off, and 90 minutes later, it happens again. In the morning, you pour coffee into yourself just to function. Your spouse asks if you slept. You lie and say yes. This has been your life for months, maybe years. I see this in the eyes of patients who walk into my practice every single week, and nearly all of them say the same thing. Doc, what can you do? It is just my age. Everybody gets up at night. Let me be direct with you. That is a lie. Getting up at night to urinate is not normal. Not at 40, not at 50, not at 70. A healthy body is built differently. Tonight, I am going to show you exactly what is broken, how to test for it yourself in under a minute, and what to do about it before bed tonight. Here is what is supposed to happen when you sleep. At night, your brain releases a hormone called antidiuretic hormone, also known as vasopressin. Think of it as a factory manager sending a memo to your kidneys. Stop, night shift, slow down production, concentrate the urine, reduce the volume. That single mechanism is precisely what allows a healthy person to sleep 7 or 8 hours straight without a single interruption. When that mechanism breaks down, it has a name. The medical term is nocturia, which simply means urinating repeatedly during the night, and it is not a small thing. Every time you wake up at night, your pulse jumps, your blood pressure spikes, and you interrupt the deepest phase of sleep, the phase in which your brain clears out metabolic waste, your neurons repair themselves, and your heart genuinely rests. Years of losing this phase is a direct path to high blood pressure, depression, and accelerated brain aging. Clinical research shows that chronic nocturia stresses the cardiovascular system faster than smoking. That is not an exaggeration. That is published data. Now, here is the part most people get wrong. They have already decided what the cause is. Men say it is the prostate, women say it is menopause or a weak bladder. They restrict their water intake until their mouth is bone dry by evening. They stop drinking anything after 6 p.m. They go to bed parched and they still get up at 2 in the morning. Why? Because they are fighting the symptom, not the cause. Imagine your home's smoke alarm goes off in the middle of the night. What do most people do? They cover the sensor with tape so it stops making noise. The right answer is to find the fire. Your bladder is the sensor. It is doing exactly what it is designed to do, emptying what gets put into it. The real question is who is filling it during the night and why. Before I tell you the answer, I need to stop and warn you about a few symptoms that should send you straight to a doctor, not to a video. Know these. First, blood in your urine without pain. If there is pain and blood, it is most likely a kidney stone or an acute infection, miserable, but not immediately life-threatening. But if you see dark red or brown urine with no pain at all, that is one of the earliest signs of bladder cancer. Do not wait. Second, sudden unexplained weight loss combined with bone or pelvic pain at night. That pattern needs evaluation now, not next month. Third, fever with burning urination. That is a kidney infection until proven otherwise. If none of those apply to you, you can breathe. Let's get back to fixing the real problem. In medicine, nighttime urinary problems break down into 3 completely different types, and the treatment for each one is different. What helps one type can actively make another worse. Type 1 is global polyuria. That means producing too much urine overall, day and night. Each time you go, the volume is large. If you collected everything you produced in 24 hours, you would measure 3 or 4 liters. The 2 main causes are simply drinking enormous amounts of fluid all day long or undiagnosed diabetes pulling water along with sugar. Type 2 is nocturnal polyuria, and this is the type found in 60 to 70% of people over 50. Here is the picture. During the day, you live completely normally. You work, you run errands, you visit the bathroom every 4 or 5 hours. Nothing hurts. But the moment you lie down, the nightmare begins. 3 or 4 trips per night, each time a full bladder, large volume. Type 3 is a reservoir problem. Here, the urges are sudden, frequent, and urgent. It feels like you will not make it. You rush to the bathroom, sit down, and almost nothing comes out. The problem here is the bladder itself, either an enlarged prostate squeezing the outlet in men, an overactive bladder in women, or chronic low-grade infection. 3 types. Frequent and large volume both day and night, that is global polyuria. Fine during the day, flooding at night, that is nocturnal polyuria. Frequent urgent urges with tiny output, that is a reservoir problem. Identified your type? Keep it in mind. Now I want to tell you about a patient. I will call him Marcus. 56 years old, construction foreman, the kind of man who only sees a doctor when something is genuinely wrong. He walked into my office with a folder full of paperwork, PSA test, bladder ultrasound, 3 different prescriptions. He told me right away, "Doc, it is my prostate, I am sure of it." He laid out his timeline. First, 1 trip a night, then 2, then 3, for the last 6 months, 4 or 5 times per night. Marcus had done what the internet tells you to do. He bought the supplements, the suppositories, the herbal blends, nothing worked. Then he reasoned, if I am producing so much urine, I must be drinking too much. He stopped all fluids after 5 p.m., and still, at 2 in the morning, he got up and released half a liter. At 4 in the morning, another half liter. Where was it coming from? He had not drunk a drop. When he sat in front of me with eyes red from sleep deprivation, I looked at his lab work. PSA completely normal. His prostate showed only mild benign enlargement. His bladder was clean. From a urological standpoint, he was nearly healthy, yet this man was suffering. So I stopped asking about how he urinated and started asking about how he lived. Any shortness of breath climbing stairs? A little, he said. Does the elastic of his socks leave a groove on his calf in the evening? Yes, he said. There is an actual indentation. And right then the picture clicked into place. I told him something that stunned him. Marcus, throw out the prostate pills. You do not need a urologist. I am referring you to a cardiologist. Here is what the cardiologist found. Early stage heart failure, completely hidden, no chest symptoms. During the day, his heart was working at its limit. It could not fully circulate his blood volume, and fluid was quietly pooling in his legs. Marcus had been treating a leaking faucet while a pipe was bursting in the basement. Let me walk you through the physics. Picture a plastic bottle half filled with water. When it stands upright, the water sits at the bottom. When you lay it on its side, the water spreads out evenly along its length. Your body works exactly the same way. For 16 hours a day, you are vertical. Standing, sitting, walking. Gravity pulls everything downward. Blood, lymphatic fluid, the fluid between your cells, all of it drifts toward your feet and ankles. When we are young, our blood vessels behave like strong elastic tubes. The valves inside our veins hold blood firmly and do not let it pool. The muscles in our legs, when we walk, contract rhythmically and pump blood upward against gravity. But with age or with a sedentary lifestyle, this mechanism weakens. Veins expand, valves start to leak, the muscle pump shuts down because we are sitting at a desk or on a couch. Fluid begins to seep out of the vessel walls into the soft tissue around them. In the loose connective tissue of the legs, up to 1.5 liters of water can quietly accumulate. That is 3 large mugs of liquid hiding in your calves, and you may not even notice it. The sock left a slight groove. So what? Your kidneys do not see that water. It is sitting outside your bloodstream. The kidneys only filter what is actually circulating in the blood. Now comes the evening. Marcus gets home, eats a salty dinner, and sits in front of the television from 7 to 11. 4 hours, legs hanging down, gravity still working, fluid still accumulating. Then he turns off the TV and lies down. And here is where everything changes. His legs rise to the same level as his heart. Gravity no longer holds the fluid in his calves. All that fluid, the water that collected over 12 hours in the sponge of his tissues, begins rapidly returning to the bloodstream. It rushes in a powerful wave toward the center of the body. Imagine someone injected an extra liter of fluid directly into your circulatory system within a single hour. That is not a metaphor. That is exactly what happens to your body every night when you have hidden fluid in your legs. And at this moment, your heart steps in. The right side of your heart begins to fill and stretch beyond its normal volume. The heart recognizes that the system is overloaded, and it releases a hormone called atrial natriuretic peptide, or ANP. ANP is a chemical telegram to your kidneys. The message is brief: dump the excess fluid immediately or I will fail. Your kidneys shift into emergency mode. They filter at an accelerated rate, expelling water and sodium to protect the heart from overload. The result is predictable. Within an hour of lying down, your bladder is full. You get up, you go, you come back. But the fluid from your legs has not finished mobilizing. 2 hours later, full bladder again. The cycle repeats until morning. That is why Marcus, who had not drunk a drop since 5 p.m., was running to the bathroom all night. He was literally drinking through his legs. Now, how do you check whether this is happening to you? You do not need an MRI. You do not need expensive lab work. You need your own thumb and 30 seconds. Sit down, pull up your pant leg, find your shin bone, the hard surface running down the front of your lower leg with no muscle covering it. Place the pad of your thumb against that bone about 4 to 6 inches above your ankle. Press firmly, hold for 15 seconds, let go, run your fingertip across the same spot. If your thumb left a pit that does not fill back in for several seconds, congratulations, you have just located a hidden reservoir of fluid. Even if your leg does not look swollen from the outside, that pit is evidence that your tissues are saturated with water. And tonight, all of that water is going to move through your kidneys. Test number 2. On your next day off, measure your urine output. Use any container with markings. Record daytime and nighttime separately. If your nighttime output exceeds 1/3 of your total daily volume, that is officially nocturnal polyuria. Your kidneys have inverted their schedule and your bladder has nothing to do with it. So what do you do about it? 3 things starting tonight. First, the foods you need to remove from your evening meal, because 3 of them are quietly making this worse. Number 1, hidden salt. 80% of the salt most people eat comes from processed food. Cheese, cured meats, sausage, deli ham, canned soup. 100 grams of hard cheese contains as much sodium as a bag of chips. You eat a cheese sandwich at 7 p.m., overnight your kidneys flush the sodium and water follows it. You wake up at 2 a.m. eliminating last night's cheese. Number 2, evening sugar. A cookie, a piece of fruit, a glass of juice before bed. Simple sugars cause a blood sugar spike, insulin release, and water retention, then a rebound flush 2 hours later, right around the time you have fallen asleep. Number 3, alcohol. The nightcap. Alcohol is one of the most powerful blockers of vasopressin. Your kidneys run at full speed all night and you wake up at 4 a.m. with a bladder ready to burst. Now the foods that actually help. First, raw pumpkin seeds. A handful, about 30 grams a day. They contain zinc and magnesium in highly absorbable form. Magnesium relaxes the muscular wall of the bladder, helping it expand to a larger volume before triggering the urge to urinate. Second, real cranberries, frozen or fresh, not the sugary juice cocktail. Cranberries prevent the low-grade bacterial irritation that makes the bladder hypersensitive. Third, dietary fiber from vegetables. Cabbage, leafy greens, zucchini. Chronic constipation means a bloated colon pressing against your bladder. Empty colon at bedtime equals calm bladder all night. Now, the protocol. I call this the bedtime bladder reset. 3 parts, morning, daytime, and evening, 5 minutes total per day. Morning, the moment you get out of bed, before coffee, stand with your feet shoulder width apart. Rise up onto the balls of your feet about an inch, then drop your heels to the floor with a light, firm impact. Repeat 30 times. This shakes your venous valves back into action and starts the lymphatic pump moving. Daytime. Shift 70% of your fluid intake to before 4 p.m. After 4 p.m., only small sips. And remove the salt shaker from your dinner table tonight. Salt only in cooking. Evening. About 90 minutes before bed, lie down and prop your legs up against a wall or the back of a chair. Heels higher than your heart, 45-degree angle works well. Stay there for 15 minutes. What is happening during those 15 minutes is the physics we discussed earlier, but working in your favor for once. Gravity is now pulling fluid out of your legs and back into your bloodstream. Your heart receives the volume signal and releases ANP. Your kidneys go into filter mode. Within 30 to 40 minutes, you will need to urinate. You will release 300 to 400 milliliters, the exact volume that would have woken you at 3 a.m. You are wringing out your legs deliberately while you are still awake and in control of the evening. How old are you? Write your age in the comments. I genuinely want to know who is watching this channel because the age of my audience directly shapes which topics I cover next, and nocturnal polyuria affects different age groups in very different ways. Drop the number and I will read it. Here is your 5-step plan for tonight. Step 1, do the thumb test on your shin bone right now. Press for 15 seconds and check for a pit. Step 2, take the salt shaker off your dinner table and replace any cured meats or cheeses on your plate with something fresh. Step 3, finish your last glass of water by 4 p.m. tomorrow and limit alcohol tonight. Step 4, 90 minutes before bed, lie down and put your legs up against the wall for 15 minutes. Step 5, when you lie down to sleep, take 5 slow breaths in through your nose for 4 counts and out through your mouth for 6 counts. I am Nathan Hayes, and I have spent 15 years watching people treat the alarm instead of the fire. Most of the time, the damage was entirely preventable. The protocol I just walked you through requires no prescription, no procedure, and almost no money. It requires only the understanding of how your body actually works and the discipline to use that knowledge for a few minutes every day. Your doctor is not going to walk you through this at your next appointment. There is no revenue in it, and there is no time on a 12-minute office visit to explain fluid mechanics and the physics of evening edema. That is what this channel exists for. Every person who subscribes makes it more likely that the next person who needs this information actually finds it. The healthcare system profits from managing your symptoms indefinitely. I profit from you not needing me anymore. Subscribe if that difference matters to you.